There are things that we could definitely be focusing on, and there's a number of measures as far as, community partnerships that would happen within the state. But one of the biggest ones is Medicaid expansion. And then inside of Medicaid expansion is, once you have that, including 6 months of postpartum coverage for women, like they just did in Georgia. They just did this in Georgia, and it is a fantastic success story, because we know that the majority of the maternal mortality, which we suffer from as one of the highest states, we know that that actually happens in the postpartum period most commonly. And so having coverage for women would mean that we would be able to follow them and catch these problems before they would become fatal in that regard. So we know that South Carolina has this particular maternal health crisis for Black mothers, who are more than 4 times likely than white women to experience this. We know that infants born in South Carolina, 1 in 5 are born to women who are receiving inadequate prenatal care. There's a number of things that we talk about for the things that could be improved in South Carolina. But and then probably one that is sort of, I say peripherally related, but it's an overlapping issue, is it has to do with education and healthcare and employment, because we know that we should have some child care tax credits for businesses and for people, because we know that children who experience high quality preschool are likely to enter school prepared for success in academics and throughout their lives, and that we have thousands and thousands and thousands of 3 and 4-year-olds in South Carolina that are not enrolled in any type of preschool program. And we know that this gives them a head start. But the problem gets exacerbated because people are forced sometimes by limited resources to decide what they're going to do as far as affordability for childcare and their ability to work. And all of this impacts a family's health, and it definitely impacts the children's education. So I think that these things are, they're not siloed off by themselves. Education impacts people's healthcare, and people's healthcare impacts their education, and both of those things impact their economic opportunity. And so I think that having those conversations with that in mind is really important, and is why I feel very strongly about having people who have a public health background and see things through a public health lens in the legislature. Policy. And my big impetus for being in this race is my absolute conviction that we need to have people of diverse thinking inside of the legislature, so we can make the legislature and the decision making there better for the people of South Carolina and representative of the people of South Carolina. And that for far too long we have had people that are not as educated in areas of public health, or appreciate how much public health impacts our economy and our schooling, and it's not siloed off by itself. It's actually very integral to the workings of a community, and it took a pandemic for us to recognize that. And so it wasn't off by itself. It had always been a thought of mine that I would eventually run for office, but this year in particular, as we saw this rolling towards us, it just became more imperative that we, knowing how South Carolina was so poorly situated, that we would have a physician as this came around to the election, so that we could have better and more resourceful decision making and more productive discussions, frankly, in the legislature, because that's what it takes, is a balance of ideas and having more people around the table that can bring a lived experience of South Carolinians to that table, and talk about the things that get ignored and sometimes pushed to the background.